Time to breathe. And we do use those phrenic nerve stimulators, maybe in people with spinal cord injury and things like that. I hope nobody is in a rush to leave, because I got to add a story that I didn't put on a tape. Back in 98, maybe, 99, a young man dove into the river where I used to practice, and head first, of course, and came to the hospital, unable to move anything, could still breathe, so C3, 4, 5 was working, but everything else below gone. And a nice anesthesiologist that gave me a chance decided to give him some medication to keep him just enough awake that he could continue on breathing, but not too asleep, so not too asleep so he can continue breathing, but also so that I can maneuver his neck. And what did he have, by the way? Let me show you. Good, I brought that along. I don't know if it's going to work because it's kind of tight together. But there are some joints in the spine, many joints. And he had taken, imagine that this is one of the spine, you know, one of the vertebrae. He had done this, boom. And what happened is that the spinal cord, the opening for the spinal cord was not cut in half. And that spinal cord was squeezed, and so he couldn't move. And when that happened, this kid was 16 years old. The anesthesiologist put him kind of under, but not completely. I put some of those tongs, we call them, that we screw in the skull after I numbed it up. And then I tried to put what we call traction. Now I'm pulling on his head to try to put those joints, those facets are locked. They're locked like this. So I have to pull and put them back in. And that would restore the full size of the canal. And I tried, and I put 35 pounds, I put 45 pounds, I put 70 pounds, and we put weight on those tongs there to stretch the neck. Could not do it. And I have a machine we call a C-arm, where you can look real time with the x-ray of what's happening to the neck. And meanwhile, the anesthesiologist is watching him so he can breathe. You know, we don't want to prevent him from breathing. We don't want to hurt him. Lo and behold, I took the tongs. I put my foot on the operating room table, and I pulled. And we're watching the thing, and he's watching, the anesthesiologist is watching, the nurses are watching, everybody's watching this kid. And with all my force, I was able to put it back in place. This kid went into the intensive care unit. For those of you in the crowd that are physicians, you will know what priapism is. I learned in medical school that when a spinal cord injury patient, and I trained at Northwestern, which used to be a center for spinal cord injury. I learned at that place that when a patient has priapism, it's over. It's not even used to try anything. They are paralyzed for good. This is what I learned. I pulled, I got him fixed. We flipped him over, we operated, all that stuff, to tie up his neck so nothing else happens. And we put him into the intensive care unit. I said, okay, I gave it my best shot. 3 days pass, the nurse in the ICU calls me and say, Dr. Engel is wiggling his toes. I said, you know what? You just didn't get enough sleep. He's not wiggling his toes. That cannot be. It doesn't happen. He had priapism. He is paralyzed for good. I helped him look again, think again. Cannot be. I wasn't a believer like I am today. And long behold, let me tell you the end of the story. What's the name of that guy that always talk about the end of the story? Okay, I didn't get it. Paul Harvey. The end of the story is that kid attended Chico State on his 2 legs. That's the end of the story. Can you see why I am not going to stop talking and I'm going to push? Because when you see something like that, that's it. You got to go at it. And what I'm telling you today, I feel just as strongly about. All right, so I don't know, I went on this tangent because of the phrenic nerve stimulator. Everybody on board with me? Nobody asleep? Deep brain stimulator, and on and on and on. Deep brain stimulation for Parkinson's. That's another stimulator. We are getting closer and closer, and we're zeroing on the fact that the brain is it. And the brain stem is a big part of it. All right, so now let me lead you over there. I think the next, I'm still stuck on diabetes. I'm still stuck on Claude Bernard, father of experimental physiology. Let's take responsibility for our own bodies. You always hear out in public, oh, I went to the hospital, I got an infection. Well, there are lots of people sitting there in that hospital. Did everybody get an infection? Is that the superbug of the century? Or is it you, your body? Is there something wrong that is preventing you from fighting that bug? Don't we know that the bugs are all over? What about the multiple surgeries? I love that one. A patient came to my office a while back and tells me, hey, I checked you out on the internet. Okay, what'd I do? Well, a patient wrote, you operated on her neck, and she had to have 2 more surgeries on her neck. Hey, if I had been an orthopedic surgeon and I operated on your left shoulder and you came back for the right shoulder, would you blame the orthopedic surgeon? Do you know how many joints are sitting in there? So I operated on one level and she had other levels that went wrong. Blame game, it's my fault. On and on and on. I won't bother you with all that, but don't kill the messenger, and worse yet, don't sue the Good Samaritan. I'm really worried. I'm becoming political here, but I'm really worried about what's going on. Just try to think about it. This woman tries to pull a friend out of the car. A friend or somebody else, I don't know. And the person became a paraplegic. Remember what I mentioned earlier? She didn't know. She got a paraplegic. The anesthesiologist may not know about this neck. This little lady, 70s, remember? Put her to sleep, make her paraplegic. Aha! You lawyers in the crowd should think about those things. We all in there together. We all in this business to help people. But what we don't know is going to get us. And that's why I am on a mission to teach. The real blame, in my opinion, we treat the heart, the lungs, the kidneys, everything. We pay no attention to the whole brain. Now let's talk about my next thing that I mentioned many times during this talk is the standard of care. The standard of care is what every doctor in your community does. That's the definition of standard of care. Should we do nothing more? It's a big question. Let's try to take the analogy of putting a standard to technology. And let's say that the standard of space travel is now somebody has decided is the moon. Well, would we have ever gone to Mars if it was the moon? If that was the standard? Same thing with telecommunication. Standard is a telephone with a wire hooked up to the wall. And we've all asked for cell phones. Now we ask for cell phones with TVs. We ask for cell phone with who knows what. Camera, capability. On and on and on. We ask for technology to lead us. Is medicine technology? To me, I think medicine is technology. If it is technology, do we have to live with it, or do we have to not take care, do any technology, new advancement? Do we have to all agree to the standard of care and leave it at that? Let the patient that has burning pain in a thigh live with it. That's what standard of care tells you. Remember, what I was doing is I was outside the box. And look where it's led me. So then we think about chronic degenerative nervous system diseases. Remember the slide where I mentioned MS and the abnormal components in the cerebrospinal fluid? What about Lou Gehrig's? You guys know what Lou Gehrig's is? What is Lou Gehrig's? A malfunction of what? The CPU. Central Processing Unit, where all the cranial nerves come out. Just go read about Lou Gehrig's. Alzheimer's. Remember the quote at the beginning? It's the whole brain that is working. When Alzheimer's is setting in, the whole brain is not working. Remember the scientist in 1850 who was taking a lobe and another lobe and another lobe, and it was proportional to the number of lobes that he took out that the dogs behaved like they had Alzheimer's. It was not a spot in the brain. It was not a gene on the dog. It was the whole brain. The whole brain needed to work as a whole. On and on, Parkinson's, Guillain-Barré, I could go on and on with this. I had other ideas. Guess I'm just thinking too much. 2004, I'm sure you guys remember the tsunami. When the tsunami occurred, I can't help it. I'm not thinking beaches, I'm thinking brain. Whole brain. I was already on my way. And I realized there is fluid, a big body of fluid. There is an earthquake. It's shaking. The fluid is going every which way. And the fluid is hitting this shore and devastation everywhere. And then I'm thinking fluid in a brain. And I'm thinking, do you know when you have stenosis? It's like you kink a hose. There's pressure in that fluid. Sure, it's not pressure like arterial blood, but it's pressure. And for the brain, it may be too much if you kinked. So the fluid may have something to do with it. And so what happened is I'm starting to think, but MS, multiple sclerosis, how do we diagnose it? Well, we'll look at the MRI and we say, there's a beach there, a plaque, we call it, an abnormal brain tissue there. And then there's another abnormal tissue there. And then it comes, and then peace, nothing happens, and then there's another one. And I'm thinking beaches. I'm thinking tsunami. And I'm thinking, could it be that the reason that happens is because that fluid is blocked? Remember, I was already thinking about the abnormal components of that fluid from the blockage, because the little filters up there couldn't work because it was blocked. Abnormal components. I want to throw those things out there in the world. And I want a clever scientist to tell me, I I got the exact kind of I have done this research. I've done this research with whatever, a bunch of bowls with water and this and that, and that fits. Do you understand? I'm putting, why did I get back on that book and all that stuff? Because I'm going to put it out there for other scientists to look at it and get stimulated and get back. And we've got to all work together and solve those problems. We're solving the heart, the lungs, the kidneys, everything, and not the brain. And I'm tired of it. Do I sound convincing? Oh, my goodness. So the brain must be floating. The brain comes to the end of your thorax. It has an amazing ability to recover. And that's one thing that people really don't understand. The brain has what we call plasticity. And the reason you know that is because you know how they said, well, this area of the brain does that? Well, if there is a stroke there, then nobody should recover from that, right? That's the area that does it. It's gone. We can see a hole and a bunch of fluid in its place on an MRI. We're done. Patient will never recover. Is that true? No. You all know patients can have a stroke and can recover wonderfully. Some people can have a stroke and it's all gone, even though they have that hole in their brain. So can you see that this localization of function is not quite cutting it? Right? Why? Because the brain has plasticity. Because other areas can take that function over and do it for the rest. And what about if it has that pluripotentiality? What if it has the ability to recover any place as long as it's floating? This is what I say. It's got to be floating. Carry one. People heard of that? I think some of my patients, of course, have heard of it. And I think a lot of the physicians know more or less because this is still a black box. When the brain stem is not floating, when the cranial nerves are stretched or deformed, when the control tower malfunctions. And here is the first picture. So now I'm going to take a little time and explain things and show you models and so on. Now you remember the cerebellum, right? You remember the brainstem in front, right? You remember the hole, the big hole, the foramen magnum, that goes from here to here. Is there something down there that doesn't belong? It's part of the brain. It is dangling down a brain hernia. I'm not kidding. It is a brain hernia. We know that herniating syndrome, we call them, okay? You can have a part of the brain, let's say you have a blood clot. Let's say you're in an accident, you have a great big blood clot that forms, and it pushes on your brain. And you know the brain, I remember I told you, has different compartments and ventricles all along the way. Well, one of those the clot is up here, and it's pushing on the brain, which then proceeds to herniate. Okay? Brain hernia. The only difference with this brain hernia from the one that I just described is the time it took for herniating. If it herniates like this, patient's dead. There are not two ways about it. You can run to the operating room, you can poke a needle in that blood clot and try to get it out. It's not going to work. Patient has herniated, the brain has not sustained the injury because it was too rapid and it had no time to compensate. When this happens in a 25-year-old patient, I don't have an apple here, but I will talk about the apple in a minute. You can look at that patient, any one of us look at that patient, say, what a wonderful, beautiful young woman. She's perfect. Why is she complaining of pain all the time? Aha. Remember, just remember, my patient with no neck pain. Remember my little old lady? The first one, the one that started it all? She had no neck pain. She had burning pain in her thigh. This young woman not only has, well, if I knew how to use that. This young woman, not only does she have that, but see that big blood vessel there? That big artery is saying, I don't care how much you squeeze brainstem, I'm gonna pump that blood up there. And I'm gonna hammer you, and hammer you, and hammer you. So, let's go back and think. I think I have a slide about that later on. But let's go back and think. Your brain is an organ like all other organs, or like a muscle. When it's working, it needs blood because it needs nutrients and oxygen. So I'm thinking, I would not want to know what my intracranial pressure is right now. But I'm thinking very hard and talking and putting all those thoughts together, and my brain is demanding blood. And so the blood has to pump up, right? My box here is fixed. So if more blood gets up there and nothing compensates and goes down, it's not my skull that's going to go like this. It's my brain in there that's going to get squeezed. Remember my young lady told me her brain was imploding? So this is not to be taken lightly. This is huge for the patient who has it. But she's young, she has a healthy body, she compensates. She doesn't look bad. Give her a few years, and she's going to be gray, always tired, probably the centers up there that control your reflexes are not going to be able to keep those reflexes down, and she may have restless leg. I cannot begin to tell you how much that CPU does. But it's big, does it all. Just for comparison, I want you to look again at this part right here. Can you see that there is nothing else but that spinal cord coming down there compared to that other patient? Next. Now I'm bringing something else in the picture. Don't look at the picture and listen to me for a minute, if you please. Phonar. I'm not paid by them. But when I saw that, I just about jumped out of my seat. That was in 2007, and I had gone to a neuroradiology meeting. And I see that, and okay, I want you to read here. Lying down, upright. Down here, recumbent. That means lying down, or here. And here, neutral sitting. So now, I have my big hole here, foramen magnum. And I already have something that's dangling down. You see it? Now go to the next. This patient just sat down. She was lying down. How much of your life do you spend lying down? You sit, you move, you turn your neck, you move, you do things. Isn't that what life is all about? And there are no radiologists in the room, but you got to think about that when you look at the MRI. So our knowledge keeps on growing, and we must keep it growing. Yes, there is a radiologist in the room. This is a sitting MRI, a company called Phonar, and I want you to look not just at the Chiari malformation here, but I want you to look at that herniated disc here. Because here that herniated disc means nothing, okay, because there's still fluid in front of it. And the spinal cord has a little bit of a dent here. It's a little bit bowed. You see the patient sitting down? And so the patient tells you, Doc, I can't sit more than 15 minutes and I hurt. My same little 25-year-old patient. Here is the regular lying down MRI. But you know, when we do MRIs, we cut and cut and cut, and we look at different areas, right? This area here is more in the midline than the previous one we looked at. And you will see not only the tonsil of the cerebellum is down into the foramen magnum, but you will see something that really makes me sad. There is a little white dot here in the spinal cord. Can everybody see that? This little white dot is injury to her spinal cord. It's injury, not only injury that's already visible. And you know that okay, I ordered this MRI, okay? Here is my protocol, Chiari protocol. I gave my protocol to be done the way I want it, so I can exactly see what's going on. The problem now is I cannot get a surgeon. Why? This is still a black box. Very few surgeons do it. Those that do it, because this is not magic and we don't win all battles, get attacked because they're outside the standard of care. And therefore the technology cannot proceed forward. And therefore the patients are out there suffering, and we can help them, but we can't. Did you know that in this country there are about 30,000 general surgeons? And did you know that in this country there's about 20,000 orthopedic surgeons? And do you know that in this country there is less than 5,000 neurosurgeons to help those people? Why 5,000? By the way, there's not even 5,000, because there was a malpractice crisis, whatever, 4 years ago, whatever. The prices went through the roof, and about 20% of them packed up and said, we're not so dumb that we're going to be taken for good Samaritan that are going to court now. We are going to do something else. They're not dumb. We're not dumb. So think about that. Because this, to me, as a human being that want to help, is a tragedy. And that's why I'm fighting this fight. St. Thomas. For those of you who don't know, the book of John, chapter 20, verse 25. St. Thomas did not believe until he saw. Lots of doctors are telling these people, like this young lady, you look beautiful. You must be crazy. They don't mean bad. They just don't know. Knowledge is what needs to progress. Knowledge is above everything, because that's what made our society what it is. Now, I would go even further than that. I would say, and I truly believe that, think about the auto industry. Think about all the insurances. All the insurance money is spent on 20% of society that has 80% of the medical problems and 80% of the medical dollars. Could it be that a good proportion of those people are people who have neurological diseases that do not kill but maim, the silent maimer? Of course it can be. The apple. Go to the grocery store, buy a beautiful apple. You're sure that's the best apple in the world. You cut that apple and it's rotten inside. This is how those people that are hurting are feeling. They hurt inside and we don't believe them. And we send them to the psychiatrist. And more drugs, more drugs, more drugs, more drugs. When is that going to end? Please believe. Your friends, your family, your loved ones, if they hurt, they are not in there to get a few dollars for workers' comp or for whatever, from whomever. They're in there because they hurt. And nobody sees it because we are not taking care of that. It's our responsibility to move the research and move the medical profession along and forget about that standard of care and get all together and fight this battle all together. Doctors, surgeons, lawyers, patients, I don't care who. And on and on and on. So here you are, you're hurting. Well, maybe you have fibromyalgia. Maybe you have chronic fatigue. Maybe you have restless leg. Maybe you have myalgia parasitica. This little lady, myalgia parasitica, the thigh. Maybe you have coccydynia. You got to take a pillow with a hole in the middle and you got to sit on that pillow because your coccyx or tailbone is hurting you. So you have a name. You have fibromyalgia, the worst of them. You have a name. Okay. So next time I go to my doctor, he's going to tell me, I hurt. I'm going to tell him I hurt, and he's going to say, hey, you have fibromyalgia. That's what it is. Go back in your box. Brain power. We have that power. All of us in this room have that power. We have the power to fight on and change that. Move technology. Move medicine along. And we all also have a power for ourselves. Because remember, as much convincing as I can be, and I met earlier a sociologist in the room. Hi. As much as I believe in medicine and in surgery, which I do wholeheartedly, you can tell, we are not doing it for you. We are doing it with you. So if you're fat, you're going to lose weight. If you whatever. Do you understand? You're going to exercise. You're going to change your stressors. You're going to move away from somebody who is driving you crazy. You're going to help me help you. You're laughing. Because I'm not the savior. I'm just giving you a better life. I'm just improving your quality of life. And if any surgeon can do that, the neurosurgeon can do it better than the others. I can tell you that. Because you look at one Alzheimer patient and you know that you better keep that brain going because it ain't pretty. And it costs a lot of money and a lot of pain. The family suffering and everything else. So the cerebrospinal fluid has to be doing its job. It has to circulate, it has to clean the brain and the whole brain, spinal cord. It has to be around. So here are all the other things you can do to help yourself. Reduce stress. I'm telling you, I'm going to reduce my stress. Tomorrow is a day off for me. Or a slow day. Don't say anything back there. My staff is watching me. So listen to your brain. When it gets too much, you start getting a headache, take a break. If you're at the office,